Okay, everyone, out of respect for everyone's time, it is 11 o'clock, actually 1 minute after, so I'm going to begin the webinar. Thank you very much. My name is Brian Riley. I'm the Vice President of Centric Benefits Consulting. We're here today to introduce you to your employee benefit website and the open enrollment options available to you. Some quick housekeeping items. I've been asked to keep this presentation as brief as possible, so I'll be speaking very quickly. Please know that the webinar is being recorded and will be added to your employee benefit website if you'd like to share it or view it again later. Some representatives from the coverage partners, Reliance Standard, Redirect Health, and Cigna are on the line and will be available for questions after the presentation. I've tried to put everyone on mute. Still, please put your audio on mute as a precaution, just in case I missed someone. Don't want any background noise to interrupt your peers. If you have any questions, please type them into the message box and we'll be able to answer them at the end of the presentation. So this is your open enrollment period. We are renewing the medical insurance with Cigna, August 1st, 2018, but we do have some additional coverage options for you that we'd like to go over. Before I begin, I wanted to touch base on the individual mandate. Many of you have seen this before. This was a large reason why we introduced MagnaCare's minimal essential coverage plan. With the individual mandate that the Obama administration passed as part of the Affordable Care Act, everyone had to have insurance. If you did not have insurance, you would pay the greater of either 2.5% of your yearly household income or $695 per person. No one likes to pay something and not get anything in return. So what Express Stores did was offer the minimal essential coverage plan. It's less expensive than the penalty and offers you at least minimal essential coverage, so you get something in return for the money that you're paying. It was a great choice compared to the penalty, and a lot of you embraced it. A lot of you actually over 200 of you embraced it and signed up for MagnaCare's minimal essential coverage plan. While you might be grateful that you were able to avoid the penalty, we are going to introduce to you today Redirect Health, and I think that you're going to find that a better option. Largely, we simply listened to the feedback that we got. People were happy with the minimal essential coverage through MagnaCare. They couldn't quite afford the Cigna coverage, but they wanted to have some other option that they could sign up for that was more robust than what MagnaCare was offering. And that's why we brought in the minimal essential coverage plan through Redirect Health, Everyday Care Plus 30, and we'll get to that a little later. Now, many of you have kept up to date on what's going on in Washington, and you might have heard that President Trump, through the Tax Cut and Jobs Act, removed the individual mandate, and that would take effect January 1st, 2019. On the federal level, that is true. Two things that I want to keep in the top of your minds as you go through this open enrollment. One is the individual mandate penalty still applies for the balance of 2018. So when you go to do your taxes in April of 2019, you're still going to have to show that you had at least minimal essential coverage in 2018. So keep that in mind as we go into open enrollment. Moving forward, January 1st, 2019 and beyond, pay attention to what your local state government is doing. New Jersey, for example, has passed a law that requires a state individual mandate. So even though the mandate is going away on the federal level, it is now going to be enacted with the same penalties on the state level. So those of you in New Jersey are still going to want to show that you have at least minimal essential coverage. And again, this is something that's going to carry forward to other states as well. So pay attention to that. Don't just look at the federal government removing the penalty. This is going to be a recurring theme, but how do I enroll in or waive the insurance covered offered? Balance Point. You're all familiar with it. Jennifer has provided a fantastic tutorial slide on how to enroll through Balance Point. We're going to get to that. The deadline is July 26, 2018, but don't wait. Don't wait. Don't put this off. If you can make your selection sooner, please do. The sooner we get all the enrollments in, the sooner we get ID cards out. So please keep that in mind. Waiting period for the plan is first of the month following 60 days. So even though this is open enrollment, if you are still in your waiting period, you will have to honor the waiting period assigned. But of course, participate on the webinar today so you can learn about the benefits. I'm going to introduce you to your employee benefit website. It's hrconnection.com. The username is Express Stores. The password is Centric123. Please keep in mind that this is case sensitive. So it's a capital E in Express Stores, capital S in Stores on the latter, and Centric, capital C. Please keep in mind that it is case sensitive. If you ever have a problem with the username and password, perhaps someone else, one of your other peers, tried to log in with the incorrect data, and that blocked out the other users, we can always reset it and turn it back on. So this is the slide that we're going to see again on the HR Connection site. This is what Jennifer produced. It's got the information on the website again, and also there is a mobile version that she included on her slide. So for those of you who prefer doing everything on your mobile device, you can use the mobile version of the HR Connection, same username and password. This is the first of 2 webinars. The second one's going to be on Tuesday, July 24th at 4 p.m. If you have any questions, please let Jennifer Trevino know. Here's her information, her email, and her phone number. Now, this is an active enrollment, which means everyone's going to do something, whether you are enrolling in one of the options that are available, the dental, the vision, Cigna, Redirect Health, whatever the case may be. Whether you are enrolling or waiving, you have to go on Balance Point to make that selection. So please remember to do that. And keep in mind that Express Stores, this balloon right here, besides the chance to participate in great health benefits, we have a chance to win prizes by making our selection through Balance Point. So all the more reason to make your selection. Now I'm going to take you to your employee benefit website. This is how HR Connection looks once you log in. Right now you'll see open enrollment flyer. That's the flyer that I just showed you from Jennifer. All of your open enrollment information is here, a full description of what you have available to you. And again, I apologize, I'm going to be talking fast through here. The customer service numbers, we wanted to put as much information on the front page for you as possible because you might just be looking for a quick phone number or quick email address. So we have Cigna's customer service number, Reliance Standard for your dental and vision coverage, AFLAC, your EAP coverage with CompPsych, Mass Mutual, so on and so forth. Various links for you to address. Down here, it's just a friendly reminder that your elections are going to take effect August 1st, 2018. Please get them in as quickly as possible. And as I said, Jennifer added a step-by-step for Balance Point. For anyone who's not familiar with it, this is what it will look like. Step-by-step instructions on how to do your online enrollment through Balance Point. And come back to the site regularly because we will be adding additional things. As you can see here, we've got a Live Well, Work Well newsletter for you, some diet tips. We like to keep this fresh. Right now, the site is set up for your open enrollment. On the left-hand side, you'll see Jennifer's contact information again. And if you have any questions that you feel more comfortable asking a third party, please reach out to our office. We'd be happy to help you as well. Now, if you look at the top bar here, you have all the selections for your benefits, your employee perks and discounts, FMLA, 401k, your employee assistance program. AFLAC, we're not going to cover too much here today. Honestly, everyone knows the duck, and I think everyone understands the coverage. If you sign up for the AFLAC coverage, heaven forbid something happens to you, the duck will give you money. That's, I'm sure that AFLAC would hate that I described it so briefly, but we all understand the time that I have available to me right now. Your health benefits, scroll over health benefits. You can see your 2018 open enrollment information, benefit plan information, your employee contributions, again, balance point, how do I sign up for the benefits, so on and so forth. I'm going to take a moment to look at your benefit plan information before I go into the 2018 open enrollment, because I'd like to make sure that everyone understands how this site works. So you have your medical tab here, and these are your medical options. The new minimal essential coverage plan, Everyday Care Plus 30 with Redirect Health, the MagnaCare minimal essential coverage, and then your 3 Cigna options. If you use the tabs here, if you're currently on the minimal essential coverage and you want to compare it to the Everyday Care, you can simply click these 2 here and then hit the compare button. You'll have these 2 plans side by side so that you can quickly and easily evaluate what the differences are. You can do the same with the Cigna plans. It holds true for your new coverage with Reliance Standard as well. Now, with Reliance Standard, we are changing your dental and vision. We're going from United Healthcare to Reliance Standard, and there's a myriad of reasons we're doing that. I'll cover what I can quickly. First and foremost, they matched what you currently have at the same cost, so there's no price increase for the coverage. It's a much more robust network than what you had with United Healthcare. Emeritus is the network that Reliance Standard will be using. They've got over 450,000 providers. As a perk to you, moving to Reliance Standard with Emeritus's network gives you a new annual maximum. So if you were close to maximizing your benefit underneath your United Healthcare plan, you now have or you perhaps used the $1,000 that was allotted to you. Effective August 1st, you have a new $1,000 annual maximum that you can draw from. So that will definitely help you if you're having more extensive work done. They have additional options as well, or additional bells and whistles as well. One of them that I like a lot is the maximum rewards rollover. There's some information on the site for that. With that, if you had your cleanings done, twice a year, and that's really all you did, you have the ability to roll over a portion of your unused maximum benefit to the next year. This is a great benefit because you might go 2, 3, 4 years without anything other than your cleaning, but then in year 4 and year 5, that's when you might need that root canal, for example. So you're able to save money up with your maximum rollover benefit. There's also an RX discount card that you have available to you if you want to use that in conjunction with your medical insurance. And the vision is nationwide. iMed is the network. National network, independent providers, convenience of retail locations, including LensCrafters, Pearl Vision, Target Optical, Sears Optical, JCPenney. ID cards for this new plan. Cigna, many of you are going to be in either re-enrolling or simply renewing the plan that you have with Cigna. For those of you who are moving over to Reliance Standard and their dental and vision plan, the ID cards will be mailed to your home. You can register with the website, with Reliance Standard's website. And that way, if you do happen to have a dental appointment scheduled in early August, you can go onto the website and print a temporary ID card. So that's going to be helpful. When you're on this page here with the benefit plan information, you can hover over and click View Plan Details. A lot of good information here. You'll have the benefit items, so you can scroll through and see the coverage that's offered under the plan. If you'd like some additional reading, you can go to the dental benefit highlights under plan documents. That's a much more elaborate, in-depth explanation of your dental benefits. And then the maximum rewards rollover, if you want to read more about that, you can do that here. And then provider, this will help you find a dentist in the network. So these are the provider links for that. So that's how you use that site. I'm now going to go over to your 2018 open enrollment. 2018 open enrollment, and for those of you just logging in, I'm talking fast out of respect for your time. I want to make sure I cover everything that I possibly can in a limited amount of time. So on this tab here, you have Cigna plans. Cigna Know Your Benefits, the mobile app, pharmacy information, MagnaCare, the minimal essential coverage, what the individual mandate is, what the benefits covered are, a sample ID card in case you want to see what that looks like, a portal guide. No matter what coverage you sign up for, you really want to sign up and register for that carrier's website so that you can get everything out of your insurance. This portal guide will help you do that. Redirect Health, Everyday Care Plus, minimal essential coverage. That's the new plan that we're going to talk about. And there is a great webinar on that. It's about 7 minutes long, so it's not too long. I would recommend that everyone take a listen to that. The prescription drug formulary under the program, a summary of what the Everyday Care Plus 30 covers. Reliance Standard, we touched on that a bit too. There are some webinars here as well. So if you want to listen to a webinar specific to those coverages, you have the option to listen to Reliance Standard's vision webinar, dental webinar, or both. These are the PowerPoint open enrollment slides that go in conjunction with the webinars. AFLAC, they also provided a 2018 open enrollment PowerPoint that you can look through and contact Josh Saunders. His information is on the home page of this HR Connection site if you have additional questions and wish to enroll. Medical summary and balance point enrollments. I showed you already the instructions that Jennifer put forward for the balance point enrollment. This is the employee contributions. Now, again, this is a very short, brief explanation of the benefits. There's more information to be found underneath the tabs, but for comparison purposes, if we were to click on that, it would bring us to this spreadsheet here. I'm just going to enlarge it a little bit for everyone's ease of use. So you have 3 plan options with Cigna. High plan, middle plan, low plan is what we've called them. Now, there is no best plan in my eyes. Some of you have heard me say this before. There's the plan that's best for the individual. So these first 2 plans are both open access plans. You'll see that the big difference with these plans here from Cigna are the deductibles. The first plan, the high plan, has a lower deductible, $500 for individual, $1,000 for employee with 1 or more dependents. The middle plan, $2,000, $4,000. Now, those deductibles do not apply to everything. As you can see here, if you go to a primary care physician or specialist, you'll pay either a $30 or $50 copay. So the big difference with these plans is that deductible amount. Emergency room, $100 for each. Urgent care, $75 for each. And then the prescription plan is the same for each of those 2 options. So again, the deductible is the big difference. For those of you who aren't familiar with a 3-tier prescription benefit, $10 is for generic drugs. I think we all know what a generic is. $35 for brand name drugs that are on the insurance company's preferred list. And then $60 for brand name drugs that are not on the insurance company's preferred list. To get that list, it's called a formulary list. You can find that on Cigna's website. The HSA, Health Savings Account. This plan with Cigna, I'm not with Cigna myself, but my family and I are all on a health savings account. With an HSA, you put in a high deductible onto the insurance. That brings down the premium, just like it would your auto insurance. You raise the deductible, it brings down your premium. It gives you the ability to free up premium dollars that you can then put into an HSA, a health savings bank account. I chose this plan for me, my wife, and our 2 daughters because, knock on wood, we don't have too many claims right now. And what I was hoping to do was free up premium dollars that I could then divert into the HSA account. Maybe we're not using the insurance a lot right now. Maybe we will down the road. I have 2 daughters. 1 or both are bound to need braces, so on and so forth. So it gives me the ability to save money from one year to the next. For those of you who might be familiar with it, don't confuse this with a flexible spending account, an FSA. The flexible spending account has the dreaded use it or lose it feature, where any unused money at the end of the year you lose. An HSA does not work like that. With a health savings account, whatever money is left in the account at the end of the year rolls into the following year, so on and so forth. It's on a pre-tax basis. The money that comes out of the account, you do not pay taxes on as long as you take the money out for an eligible expense, medical, dental, vision, what have you. So it's kind of like a medical 401k in that sense. But as you can see, you have a high deductible, and this deductible applies to everything. So everything applies to the deductible. The earlier two Cigna plans, the deductible did not apply to everything. HSA, the deductible applies to everything. As you can see at the bottom, these are your contributions towards the insurance per paycheck. So you can see the HSA obviously is much less expensive. It's $104 per paycheck versus $221 or $231 for in a single employee under the two other options. So these are your contributions. I won't go into them in great detail because, again, you can access this webinar later. So we'll go to the minimal essential coverage plan. What you have in place now, again, what over 200 of you are enrolled in, is the minimal essential coverage plan with MagnaCare. Now, again, it's minimal essential coverage. It's the least amount of coverage that you need to be able to avoid the penalty. So it's not as robust as what Cigna offers underneath their programs, for example. But still, it's something for the money that you're spending instead of just paying a penalty and not getting anything. Your primary care office visits are $25. You have a telemedicine benefit under this and under Cigna as well. Telemedicine, really quick. You should look into this. You should sign up for this. You're all busy. You don't always have the opportunity to contact a doctor or sit in a doctor's waiting room. The telemedicine allows you to call a doctor. You can Skype with a doctor or video chat with a doctor. Show them the rash that's on your arm or the blister or what have you, and it'll save you that trip to the doctor's office and save you time. So it's very convenient, especially at 3 o'clock in the morning if it happens to you and that's when your kid's sick. Having a telemedicine benefit is a lot better than debating whether or not to go to the emergency room. So please sign up for the telemedicine benefit. But again, this coverage is minimal. So it's going to not cover anything in the hospital, for example. You do have some prescription benefit, $2 for generic, $50 urgent care, but no emergency room covered. Again, this was the minimal essential coverage required by healthcare reform so that you could avoid the penalty. Not a whole lot is covered under the plan, and you are restricted to the network. Actually, quick caveat, yeah, you're restricted to the network here. It's an in-network only plan. You have to go to a MagnaCare participating provider. The Cigna plans also are in-network only plans, so you have to go to a Cigna provider. But the MagnaCare MEC plan doesn't cover a whole bunch, and that's why it's only $16 per paycheck. The feedback that we received from those who are enrolled on the plan were that they were happy to have a less expensive plan. They were happy to have some coverage instead of none. While they might not have been able to afford the Cigna coverage, they still wanted to, they still would be willing to pay a bit more for more robust coverage. So enter Redirect Health Everyday Care Plus 30 plan. This plan is different. I like it a lot. For starters, it has an open network. What does that mean? It means that you're not limited to a particular network of providers. What you're going to do on this plan is you're going to call Everyday Care Plus 30, Redirect Health. You're going to call them before you do anything. Before you pick up a prescription, excuse me, before you pick up a prescription, before you go to see a doctor, you're going to call them. They're going to serve as your advocate. They're going to find you a lab, an x-ray, a provider that's in your area where an affordable price can be obtained. You have 0 copays for the primary and specialty services. And then for additional items such as the hospital, if you do find that you need to get admitted into the hospital or go to an emergency room, you contact them. They will help you with it. They will provide you a benefit. So inpatient hospital, for example, they'll provide you $250 per day to defray the cost of your hospital stay. But it's not just what they're paying you. They're also advocating for you on that benefit as well. In-network, out-of-network, you don't have to worry about that with this program because, again, you're going to call Everyday Care for everything you do. You're going to call Dr. Mom, and Dr. Mom, and I'm David, if you're listening to this, you didn't give me the green light to refer to you as Dr. Mom, so hopefully that's okay. But you're going to call them first, and they're going to guide your care. So it's an advocate for you. It's less expensive than the Cigna options. It is more expensive than the minimal essential coverage through MagnaCare, but again, that was the feedback that we received. Individuals were willing to pay more. They possibly couldn't afford the Cigna coverage, but they were willing to pay more if they had access to coverage like this. All right? So you can go back and look at that piece. Excuse me for a moment while I try to get back to the home page. And at this point, I've introduced you to the website. I've introduced you to the coverage and how to access the information on your own. And I will open it up to questions, but I will begin with David. Are you there?
I am, yes. Good afternoon or good morning.
Great. Thank you very much. David is representing Redirect Health Everyday Care. I'm going to pull up that benefit summary while we're on the phone. Again, everyone, I covered everything that I believe I was asked to cover. Thank you very much for the time. And those of you who would like to remain on the line to talk about, to ask any questions, I will pull up the chat box and see if I can answer any of those for you. So bear with me while I do that. David, is there anything else you wanted to add while I'm doing this legwork here? Is there anything that you wanted to add about Everyday Care that possibly I didn't touch on?
Yeah, I think one of the fundamental pieces and components of our plan and the benefit to you as an employee is, the integrated telehealth component and app that is associated with that. So again, when you call Dr. Mom, and it's funny that Brian mentioned that because we're actually referred to as the doctor in the family. So when you call us, we are able to, in many cases, diagnose, create a care plan, and even prescribe right over the phone. We have an integrated app that you can download that allows you to text, email, and do video chat with our providers, again, 24 hours a day. Can't help you over the phone, and we need to get you into a primary care doctor or even a chiropractor. We will find that position for you around your schedule the appointment, and get you into that primary care office visit or chiropractor appointment for $0 copay and no additional out-of-pocket costs. So it's a great benefit. It also provides, obviously, the minimum essential coverage, so your physical, all woman exams, mammograms, et cetera, that's outlined in the ACA. But it also provides care for those sick visits. My kid has pink eye, I have a rash, I have a cold, I need a refill on a prescription, et cetera, et cetera.
All right, sounds good. The important thing, again, everyone, call that phone number first. You need to call that phone number before you access care. So you do need to call Dr. Mom. And as you can see on my screen here, these are the benefits that are available to you. Now, the minimal essential coverage plan with MagnaCare focuses on the medical. But the program here, again, it does have a hospital confinement emergency room benefit. $250 would be paid to you, similar to what Aflac would do there. This defined benefit is what they'll pay you to defray the cost, and of course, they'll help you with that hospital confinement. In addition, critical illness, heaven forbid you're diagnosed with a critical illness, Redirect Care would provide you with $1,000 heart attack and stroke, they'll provide you with $1,000. Accident-only benefits, up to $2,000. Accidental death and dismemberment, heaven forbid you lose a limb, what have you, there's benefits there for that as well. So there's a lot of additional benefits that are available underneath this program. I'm going to take a moment to go over to the question board. One question is very important. If we have a prior appointment already scheduled for August 5th, will we have our new cards by then? If you are renewing your coverage, I don't know if this individual is enrolled with Cigna, for example, but if you're renewing your coverage, then your ID card will not change, your group number doesn't change, your individual ID does not change. So no worries, you can still go and have that procedure or that doctor appointment on August 5th. I had one person say that they couldn't hear. I think that was alleviated by their peers. Which insurance would be most beneficial for mental health? You can look at the more elaborate plan design descriptions on the site, but I'm going to tell you up front that I believe that one of the Cigna options would best serve you. If you have children, is the price shown reflecting one child, or does the cost cover all children? So when you see employee and child, that is one child or 5 children. It doesn't matter. So family, it would be an employee, their spouse, and as many children as that couple has. And just looking through the questions, and I think that's really it. I think we covered everything that was asked. Everyone, if there's any additional questions, please chime in now. Otherwise, Lori, you're there?
Yes, I am.
Okay. Lori, is there anything about Reliance Standard and the Meritus Network that you want to add before we log off?
No, I think you covered it all, Brian. I think it's exciting to have a larger network for employees, plus the new annual maximum that will start on August 1 through the end of the year, and then it'll reset again in January. So it's a great time to enroll in this dental plan. But I think you covered all the benefits, and the PowerPoint presentations and the webinars that are included are also valuable for additional information for people to listen to.
Absolutely, thank you. And again, I would have loved to have opened up all of those attachments, but I just didn't have the time available. One individual asked about the HSA savings plan. Yes, the money that goes into the account is pre-tax. So if you deposit it yourself, you can write your deposits off on your individual tax return. So it goes in pre-tax, it grows with no tax implications. And when you take the money out of the account, as long as you take it out for an eligible expense, medical, dental, vision, what have you, you do not pay tax on the money that you take out. If you take the money out to reface your cabinets or buy a flat screen TV, yes, the IRS will definitely have a problem with that. But if you're just using the money for eligible expenses, and there's a lot of eligible expenses, like I said, medical, dental, vision, long-term care insurance premium, these are all eligible expenses under the HSA. As long as you use the money for an eligible expense, you will never pay taxes on that money. I made the analogy about it being kind of like a medical 401k, and that's because when you reach certain thresholds, you can actually invest the money, which luckily I was able to do, where I was able to put some of my HSA savings into various mutual funds to further growth for expenses down the road. Again, medical 401k, if you are healthy and not using it at all, that's fantastic. You're building up a nice nest egg there for those expenses down the road, or maybe those retirement expenses when you get into your Medicare years. That's the idea of that program. I have one person who said that they have several questions after reviewing the slides, but I'll need you to elaborate on those. Or please contact either me, Maria Gerkens in my office, or Jennifer in the HR department. Oh, that individual heard what I said and said my questions were answered. All right. Well, everyone, I'm not going to keep you on the phone any longer than I need to. Thank you so much for the time that you've allotted to participate in this call. Again, my apologies that I had to speak so quickly. Out of respect for your time, I know that a lot of you want to get back on the floor or get back to the next task. If you have any questions, please let us know. Please log in to the second webinar, which is going to be held on Tuesday at 4 o'clock. Thank you again for your time. And if there's nothing else, I will end the call. Thanks, everyone.